Hello everyone, welcome. My name is Ainembabazi Innocent, a first-year medical student from Gulu University, taking you through sickle cell disease. Sickle cell disease has been a huge burden to Uganda, mostly in the northern part of the Uganda, where the cases are registered at an increasing high number each and every other day that goes by. So sickle cell disease, this is a disease that involves the sickling of our red blood cells in the blood vessels, and this creates on many more complications, such as impedance of oxygen transport to the tissues that require oxygen, for example, the brain, the heart, the lungs, and also other body systems, and also body organs. So the pattern of inheritance of sickle cell disease is that it requires one to attain 2 copies of the default gene from either parents. So in such a case where the mother is either sickler or a carrier, and the father also is either sickler or a carrier, such a person will attain sickle cell disease, since the genes that will be formed up afterwards of hemoglobin will be deformed, which we term as the HBS genes. So the main manifestations of sickle cell appear after the age of 5 months, and this involve stroke, whereby someone has decreased oxygen supply to certain parts of the brain, and this results into convulsions, seizures. We also have priapism. This occurs in the males where they have painful erections and which take on some bit of long time. We also have swelling of the hands and feet. We have busting of the skull. Also have acute bacterial infections, which are always on the rise in these people with sickle cell disease, as their body is not able to fight such bacterial infections. We also have some urinary signs, which include inability to form concentrated urine. Most of the urine formed is always dilute by the sicklers. So in the symptoms, such a person will always attain pain, high episodes of pain, and which are always acute on and off. And then also they will have pain in the chest, which forms up some of the symptoms of the acute chest syndrome. So one has to know how this disease is attained, that is through inheritance. And so this is how we can drive to know how to prevent the disease. So it's very important that couples who are intending to get married, that they always attend premarital counseling. And in this premarital counseling times, they will always have to test for some diseases and complications. And yet, it's a wonder that sickle cell has not been among the tests of choice to many people, as they neglect it and maybe go for HIV and AIDS and other conditions, which is okay. But it's good to know that, to test and know the trait that your partner is having. If either your partner is a sickler or is a carrier, or if your partner is normal or your partner is normal. So with that said, a person has to go for sickle cell screening, both the couples, so that to know what's their stand in this. And with that, we are able to prevent the rise of sickle cell disease in Uganda and Africa at large. Thank you for your time and listening. Stay blessed. God bless you all.